Dr. Marcia Venegas Pont. Dr. Pont is an internist in our breast clinic in Rochester and will be speaking on the topic of nipple discharge.
Thank you, Sandia, for the introduction, and thank you, Barb, Sarah, and Sandia for having me here today. Good morning, everyone. I have no disclosures. The objectives for my talk today is to review the type of nipple discharge, which are physiologic and pathologic, discuss management of different types of nipple discharge, and discuss the frequency of breast cancer and high-risk lesions diagnosis in patients with pathologic nipple discharge. Nipple discharge is a chief complaint in 2 to 5% of women visiting healthcare providers. Although it's a frightening and very scary symptom for patients, usually nipple discharge etiology is benign. Nipple discharge is physiologic, and it is a relatively uncommon presenting symptom in breast cancer, representing 5 to 10% of diagnosis of cancers related to nipple discharge. There are two main types of nipple discharge, including physiologic. In these cases, the nipple discharge is bilateral, involving multiple ducts. It's non-spontaneous. Patients most of the time are manipulating the nipple, and it's associated with the stimulation of the nipples. The second type is the pathologic nipple discharge, which is unilateral, involving a single duct, and it's not spontaneous. In order to review the type of nipple discharge and the management, I will review a few cases with you today. The first case involves a 41-year-old woman who presents for evaluation of 3 months duration of milky white discharge. She has 3 children. The youngest is 1 year old. She nursed her youngest child for 6 months. She has noted bilateral, spontaneous, white, milky discharge. It stains her clothing, and she's using nursing pads. She has no other associated breast symptoms. Her last mammogram within the last year was normal. Physical exam revealed bilateral, involving multiple ducts, expressible discharge, milky in color, but the exam was otherwise normal. This is the finding during the physical examination. So what's your diagnosis? For this patient, could you do a diagnostic mammogram? This is a case of physiologic nipple discharge, specifically galactorrhea, which is benign, and no breast imaging is needed at this time. Patient can be reassured, and